Dr. Ucell and Dr. Gupta, I guess, had come up with this wonderful plan, and it really is. I'm not being sarcastic here, it is a wonderful plan. A lot of the eyes from the eye bank can be used for teaching purposes. Instead of throwing the eyes to the biohazard bin, they had talked with the lady in charge. They were quite in agreement to send the eyes over that they didn't need or couldn't use. I just started processing the eyes and sectioning them, staining them. That work started at Once Banana, and then that grew into the Eye Biobank. The specimens have grown now to about 1,200. So they're all in a database. Taught myself how to use the computer. Yeah, the Eye Biobank is up and running. So anybody from all over the world can write in and ask for sections on whatever disease they might be interested in. So I actually grew with this job, and it's been very, very fulfilling. It really has. My mother had subscribed to a magazine, and I happened to be leafing through it one day, and oh, that's interesting. And these are for careers for women. One of them was just brand new, starting out, was medical technology. And I thought, whoa. So I went through and I thought, oh, not bad. I like that. My mother came down here to continue her teaching, and because she had her teacher's certificate both for Saskatchewan and Ontario. She was able to get a job down here in Ontario, no problem. No internet back then. It was just all pick up the phone or do the letter writing. So she was able to make contacts for me through Toronto General Hospital at that time. It was not joined with UHN. Toronto General and Toronto Western. So Toronto General got back to me because they were starting up a technology training program. And of course I mentioned, that I liked the chemistry, the physics, and the biology, and of course that was a good asset back then, that you had all three sciences. So I got in. It was a small class. It was only 19 months long, the training program, and graduated. And then for a little while I continued on in surgical pathology at Toronto General in the histology section. And I enjoyed it, because during our 6 months training, before it was more written work and exams before we actually were allowed upstairs into the labs. And the training back then was literally by pipette, and none of this automatic stuff. I think they were just starting to bring in the automative technique for blood sugars and some blood chemistry work, but just took out the book and just read the directions and away you went. When I got to histology, of course, it all depends, of course, with the different departments that I went through. Was biochemistry, and there was blood banking, and histology, and microbiology, which I really enjoyed. It depends on who's teaching the class. If they're really gung-ho about their subject matter, you tend to learn more. And definitely with histology, it was the pathologist at that time. He's written a couple of pathology books, but he's not alive now. But made it very interesting for us, and I was able to click, I guess you could say. It was through Toronto General Hospital in histology, so I was there just for a short while. The histology pathology lecturers happened to be my boss at that time, and he had heard that there was a new technique for processing eyes, and would I be interested? And I said, sure. So he set up the appointment for me through the chief of the Department of Ophthalmology, so I went for the interview. It was a Friday afternoon. It was Professor McCullough, Thomas McCullough. He comes shuffling out of the OR in his scrubs, and it was just over the noon hour, so he fires off all these questions, and thinking back now, I thought, how on earth did he know all this? And I said, well, if I don't know, I'll just pick out the book and I'll learn. So I guess he liked my attitude. Anyways, okay, he said, I've got to get back into the OR, and he said, I'll see you Monday morning. That was it for the interview. I said, okay, thank you very much. It was actually new back then. It was a paraffin technique. It was developed at the Armed Forces Institute of Pathology. The paraffin technique replaced the Soloidin technique, which is a long, tedious process. It took about a month to do one specimen. This is why this technique, among other things, was developed, this paraffin technique, was to speed things up. So that when we got an eye, say today, operation, and the eye was enucleated and had a tumor in it, or a suspected tumor, it was sent into 10% formalin. Today is Monday. Then it would be washed and ready for, say, Dr. Hunter back then, we'll backtrack a few years. It would be ready for him when he came in Friday morning for his teaching session with the first year ophthalmology residents. Now these are residents that have their MD and they're specializing in ophthalmology. You know, the sections that I had prepared of biopsies, which can be anything, they could be corneal grafts, iris biopsies, for instance, if they're suspected a tumor or not, or things like that. And lid biopsies, pieces of lid. And, you know, after a few years, and Dr. Hunter showed me how to do the garsing of the specimens, that would speed things up for him, because sometimes we got quite a load of specimens coming in. It was a very, very busy lab. I think one year we averaged about 300, 400 specimens. And that's a lot. That's eyes and biopsies. So that is a lot.